Hello, I'm Cheryl Anderson, the Medication Safety Pharmacist for the Carolina Center for Medical Excellence, known as CCME. Today, I want to talk with you about preparing for your next healthcare provider visit by using a program called Mind Your Meds that promotes safe medication use. Mind Your Meds is an easy to follow program that empowers you to take action with your own healthcare so you can be ready for your next in person or telehealth provider visit. Adverse drug events or harm caused by medications occur in 15% or more of seniors that visit physician offices, hospitals, and extended care facilities. These events are potentially preventable up to 50% of the time. By having an accurate medication log, being prepared for your medical appointments, and taking ownership of your health care, you can help reduce adverse drug events in seniors. This program is designed for caregivers and older adults like you. It can help increase your confidence about managing your medications with your healthcare provider. Before your next doctor's appointment or pharmacy visit, review these 5 tips for using medicine safely. First, it is recommended that you bring an accurate and complete list of all your medications to all your healthcare visits. This includes your prescription and over the counter medicines, any vitamins and herbal supplements that you use, and let's not forget eye drops and insulin. Do you already have a current medication log? If not, let's review a sample medication log, which you can list all your medications, note the time of day you take them, the reason for taking them, and the healthcare provider who prescribes this medication for you. Don't forget to make sure your name is included and the date you last updated your log. If you have any significant drug allergies, please put a note of them on your log as well. Now that you have an updated medication log, tip 2 is to ask questions about your medicines and make sure you understand the answers. If you find it difficult to remember the answers to your questions, 2 solutions come to mind. Take a family member or caregiver with you to your appointments, or use a notepad to write down your healthcare provider's response, or even ask your provider to write down the answers for you. Tip 3 is to make sure your medicine is what the healthcare provider ordered. If the new medicine looks different than what you expected, or if a refill looks different from what you have been given before, your pharmacist is just a phone call away. Ask him or her to double check for you. Usually, you will have been given another generic brand, the same drug, but manufactured by a different company. However, sometimes mistakes can be made. In fact, most errors are first found by patients. Moving to tip 4. It is so important that you are using your medications correctly. If you have any questions or don't understand the directions for use, have your pharmacist or healthcare provider explain anything you don't understand. Make sure you are aware of any medicines, foods, or activities such as driving, drinking alcohol, or using tobacco that you should avoid while using the medication. Sometimes lab tests are needed to see how your medicine is working or to make sure it doesn't cause harmful side effects. So always ask if any routine lab tests are needed for all new medications. Tip 5 is to always ask about possible side effects. Sometimes side effects may bother you with minimal harm and will get better after you've been taking the medicine for a week or 2. But if you have serious side effects, like difficulty breathing, or if the side effect does not get better, a call to your pharmacist or healthcare provider right away is needed. A change in medicine or a change in the dose may be needed also. We hope you have found this medication safety program, Mind Your Meds, helpful as you navigate through the healthcare system. It may be helpful to print out the 5 tips for using medicine safely before your next doctor or healthcare provider appointment. Don't forget to take our brief survey to let us know how you plan to use this information, and be sure to share these tips with your family and friends. We want you, your family, friends, and caregivers to be prepared for the next in-person or telehealth medical appointment. This program is sponsored by CCME. CCME is a partner in the Health Quality Innovation Network, known as HQIN, consisting of the states of Kansas, Missouri, South Carolina, and Virginia. Thank you for joining us today.